MS or multiple sclerosis is a demyelinating disease affecting the myelin sheath which covers the axons or the nerves. The axons are the extensions of the nerve cells which connect with the other cells, and they are covered by the myelin sheath. And when this myelin sheath is damaged by an autoimmune process, this disease is known as multiple sclerosis. As explained earlier, it is primarily an autoimmune disease, which means the body's immune system attacks the myelin sheath of the nerve, thereby leading to demyelination and to poor activity in that nervous system. So multiple sclerosis is primarily affecting the nerves of different parts in the brain as well as the spinal cord. Depending on the area that is affected, several symptoms can manifest in multiple sclerosis. Some of the common symptoms are blurring of vision, weakness in the muscles of the eye leading to improper eye movements. There can also be sensory and motor deficits in the lower limbs. Occasionally there can also be problems with bladder and bowel movements and so on. There are several types, especially there are 4 predominant types of multiple sclerosis. The most common form of multiple sclerosis is called as the relapsing remitting type of multiple sclerosis, wherein there is an attack of acute autoimmune reaction leading to demyelination, which stops after a period of time, and thereafter there is a partial improvement in the condition as the myelin sheaths grow back. But very often the recovery is not as complete as before the situation. So there are episodes of attacks followed by remission, and thereby the problems keep coming in bouts. It can be spread over months or it can even be years, and over a period of time the symptoms get worse and worse. This is the most common variety and is known as the relapsing remitting type of multiple sclerosis. There is the secondary progressive multiple sclerosis, followed by some period of initially the remitting relapsing type, then the disease becomes continuously progressive and doesn't go back to remission. It keeps progressing until the situation becomes worse. This is the secondary progressive multiple sclerosis. The third variety is the primary progressive multiple sclerosis, where right from the beginning there is no remission in the condition and the condition keeps on getting worse with time. This is called as the primary progressive multiple sclerosis and is one of the very severe forms of multiple sclerosis. Even worse than that is the relapsing progressive multiple sclerosis, where there is a sudden acute episode on top of an already progressive type of a multiple sclerosis. This is among the worst and leads to disability in the fastest possible time. Women are more prone to multiple sclerosis than men. The cause of multiple sclerosis are divided into genetic factors and environmental factors, though the exact causation is still not known. Genetic predisposition to multiple sclerosis is understood. So also there are environmental factors that trigger multiple sclerosis. One of the common environmental factors is infections, viral infections in particular, and the second one, which is known to have an impact, is vitamin D deficiency, which explains why people in the equator are less exposed to multiple sclerosis as opposed to people who are further away, who are exposure to lesser amount of sunshine and therefore to lesser vitamin D. However, we are finding that even in countries like India, where there is adequate sunshine, more and more people are getting into vitamin D deficiency. And we also see that the rate of multiple sclerosis is growing up even in a country like India. If you look at the treatment for multiple sclerosis, there is no cure for multiple sclerosis in conventional medicine. Treatment of multiple sclerosis is aimed at bringing out the remission much faster and to prevent the relapses. The main aspect of treatment is mainly targeted at the relapsing remitting multiple sclerosis. There isn't very effective treatment for the progressive type of multiple sclerosis in modern medicine. Immunosuppressants like steroids, cyclophosphamide and other immunosuppressant drugs are used to prevent episodes of relapses in patients with multiple sclerosis. And as is known with the use of immunosuppressants, it presents with number of side effects. That is what limits the use of these treatments in many patients. There is also the additional aspect of physical therapy, rehabilitation therapies and so on and so forth, which help in maintaining the muscle tone as well as functionality in patients and to help them to recover their muscle function and so on after an attack is over. The Ayurvedic approach to the treatment of multiple sclerosis is again through mediating the immune system. Ayurveda has a wonderful mechanism of treating autoimmune diseases by offering herbal products which are immunomodulatory in nature. Ayurvedic treatment for several autoimmune diseases like rheumatoid arthritis and so on and so forth is very popular. So also Ayurveda has an ability to treat autoimmune diseases like multiple sclerosis. We are able to get a relapsing stage into a remission much faster along with just as immunosuppressant drugs are able to with Ayurvedic medicines and Ayurvedic therapies. The whole range of Panchakarma or eliminative or detoxifying therapies in Ayurveda are very helpful, especially Vasti, which is one of the most important of the detoxifying therapies used in Ayurveda, is extremely effective in recovering from a relapse of any of these of multiple sclerosis. It helps to bring down the immune mediated attack to the myelin sheath. Ayurveda also has wonderful treatments that help in the remyelination process. Like any disease where there is a demyelination, Ayurvedic treatment is also able to be supportive in the remyelination process which is natural in the body once the immune system is again not attacking the myelin sheath. So Ayurvedic treatment comprising of both the immunomodulatory aspects of treatment as well as the remyelinating aspect of treatment becomes a very wonderful add-on to the treatment of multiple sclerosis. We at AVN Arogya offer the entire scope of Ayurvedic treatments comprising of Ayurvedic herbal preparations as well as the Panchakarma and the Upakarmas, the therapeutic procedures that are described in Ayurveda, with the main treatment being Vasti, Nasya and so on, which are extremely helpful in re-establishing the myelin sheath in patients with multiple sclerosis. So we are finding excellent response in patients who are affected by multiple sclerosis in terms of getting them into remission without the need for using immunosuppressant drugs. We are also able to sort of slow down the relapses that are happening. However, it's not that all patients with multiple sclerosis can be completely cured. Once the condition of multiple sclerosis has gone past a particular situation where it has become extremely progressed and there is residual weakness, the relief is not as pronounced as it is if one starts treatment very early and when we are able to prevent recurrent episodes of relapses in a patient with multiple sclerosis. The success with progressive multiple sclerosis, however, is not as great as with relapsing remitting multiple sclerosis. Nevertheless, we are able to see definite improvement in the physical abilities as well as in the disease progression not being as fast as it used to be without the Ayurvedic treatment in place. So this is a gamut of what AVN Arogya can offer for a patient who is suffering from multiple sclerosis. We have had several patients who are able to be free from the use of immunosuppressive drugs and who are only on Ayurvedic treatment and both comprising of immunomodulatory and remyelinating treatments from Ayurveda, and they are able to lead better quality of life.
Go here to subscribe.